Good afternoon. We are ready to open up the Minority Caucus meeting. Thank you all so very much for coming. Today is Monday, April the 13th, and I hope everyone had a happy Easter. Glad to see that you were able to join the call today. We have pretty much a short, pretty brief agenda. But I know that there have been quite a bit of concerns going around as it relates to COVID 19, especially as it relates to the African American community. I just want to give an update of what it is that I've been involved in as chair of health and hospitals. So I had an opportunity to reach out to Jim Harbison and Matt Wilshire to tell them that I thought that it would be a good idea for Nashville General for them to reach out to Nashville General, start having some screening and tests done over in the public housing facilities because they, live so close to one another. I know many of them have been out, having cookouts and participating in gatherings, which put them at further risk than the normal. And they were very receptive of that. I was able to work with Nashville General, who also has a testing company out of Atlanta, Capstone, that they work with, who would provide the testing for COVID-19. And we were able to set up on this past Friday and Saturday at Garnet Studios in Edge Hill. And we were able to screen about 50 residents, and we did 20 tests on those residents. We should be receiving back. Dr. Alicia Hall was the attending physician who managed and did all of the screening, the initial screening and primary screening of those individuals to recommend them for tests. And it went pretty well. And I know that MDHA plans to work further with Nashville General Hospital and possibly go in the other public housing facilities that they have. I'm not sure at this point if they're going to get started on this Friday and Saturday, but I do know that Dr. Hall is volunteering her time, and Fridays and Saturdays are the days that her office is closed, and she's offered those days to continue this work, which we were really, really happy. And Dr. James Hildreth of Meharry also offered to support the effort in any way that he could. We basically were asking for them to provide a couple of students to help with the screening, because as we saw when we got there, ready to open at 9 o'clock, it was a line of people ready to be screened. And so many of them had to, wait until we got through the screening process and moved it on. And if we had some students, it would have made it a little bit easier. So that was on Friday. On Saturday, it wasn't quite as many. We didn't have the students then, but it was able to, flow pretty smoothly because the president of the neighborhood association was there to help one of the managers of the building there, and I was there, and we had, several people on deck that were able to help with those screening activities. So I was really pleased with the participation and the outreach in itself. So I didn't know if anyone else wanted to add things that they've been doing, or if anyone had any questions.
Madam Chair, can you add Councilwoman Sawara and Sandra? Also, they've joined as attendees.
Okay.
Can they not sign on, or are they on?
No, it's the host, Rosie. She knows how.
Yeah, they were having difficulties, obviously, Rosie. So I've just been able to sign them on.
Okay, thank you.
Thank you, Councilwoman Burchett, for that information.
They're on now. Thank you.
Yeah, thank you very much. So I don't know if everyone had an opportunity to hear um, my update in terms of working at Gurnett Studios on Friday and Saturday, or if there are any questions in regards to. Councilwoman Virtue, are you still wanting to speak, or was that for the previous statement?
That was for the previous statement.
Okay. Councilwoman Gamble.
Thank you, Madam Chair, and thank you for your work in trying to increase our testing, particularly in the minority community. I was wondering, was that testing that you did this past weekend specifically for the Edge Hill or for a specific community, and is there an opportunity to expand that throughout other communities?
Well, it was specifically for Edge Hill and Gurnett Studios because we had permission from MDHA. We didn't want to just go anywhere and set up, but wanted to go into an area that we knew that was likely at risk. So starting with the senior facilities that they had there on Friday and Saturday, which, you know, a lot of the families are right around in the Edge Hill community, right around Gurnett Studios. While we did have the families and we passed out flyers and we did it pretty quickly, the response from the families was not as much as we would have liked, but we did get a good number of residents who were concerned. And I think it put them at rest, just knowing that they had the opportunity to be tested, and they came out. And as I said, when we got there, there were people waiting. When we came back from lunch, they were waiting. So they were coming timely, and they were pretty steady throughout the day, whether it was one or two people that came at 9, and at 9:30 you had one or two. But overall, we had about 50 people in the 2 days who were actually screened and about 20 that were tested. And as far as it being expanded, yes, it can be expanded. And as I said, I know that Jim Harbison does plan to utilize Nashville General, and I'm not sure what their plan is to do that. If they want us, I know Harbison was talking about going over to Casey, and they have Edgefield at Casey also. But, you know, people are just not going to just come and show up and do it. So we're going to have a little bit more time now to publicize that the screening is going to take place. And I'm sure as the numbers continue to increase, it will pique the interest of some individuals now that we will be close to them for them to be able to come over and get screened. But the majority of them were not symptomatic. I know that Council Member Hall had been talking about some things that he was going to do with Meharry. And I spoke with President Hildreth, and he told me that they were planning on maybe reaching out to some of the churches in the next coming week. And Dr. Bailey from Metro Health also said that that was one of the things that they were advocating, was to reach out to the churches and maybe get the church roster and call the people of those churches and see if it's anything that they particularly needed. Is there a particular area? And Dr. Hildreth said he wanted to start in North Nashville. And I do know that I saw that Senator Gilmore indicated that there were free testing being done at 21st and Hermosa on today. but I thought that was the regular screening that was being done. I'm not sure if that was a new location from what Meharry was doing. Does anyone know? Hello? Wait a minute.
We hear you, Madam Chair.
Yeah.
Oh, I was just saying, this is Jennifer Gamble. I was saying, we hear you.
Oh,
I don't
okay.
know. Thank you.
Okay.
You answered my question. I'm not aware of that testing site on Hermosa.
Right.
Okay. Madam Chair.
Yes.
The testing on 21st and Hermosa is the regular one that was set up before, so I don't think it's a new one.
Okay. Because I thought that was Albion and not, yeah. But that's saying, Councilmember Sepulveda, did you want to speak?
Can you hear me?
I do.
Yeah, I just had a quick question, and I don't know if you would know the answer to this. Metro Action and United Way, are they asking for Social Security numbers when people come and ask for help or apply for help?
You know, I don't know. I got a letter from, let me see, where did I get that email from? Ricky from the director of Metro Action. So I don't know for sure if they are asking for Social Security numbers. I know that would cause a problem for some people. Let me see.
Yeah, since we're encouraging people to stay home,
Right.
there are a lot of folks that if they don't have access to certain resources, they aren't able to provide for their family, and they risk their own safety and the safety of others when they feel obligated to go to work.
Right.
So I that's just so if someone knows or if someone could ask, I mean, I could also ask and follow up. But I do think it's important that we have that information. I know they are giving money to certain organizations, and
Right.
I believe that they're not asking for Social Security numbers, but I'm
Right.
not 100% sure.
Okay, let me see. I'm looking for this. I found the letter, and it doesn't speak to whether they have to provide Social Security numbers or not. But I can reach out to Dr. Kroom and ask them if they could change that and not, put people at risk of and create even greater a greater problem for them.
Yes, that would absolutely be great.
Okay, I will do that.
Thank you.
I see that Brandon, did you get on? I guess not. I'm trying to.
Councilman Hurt. This is Delicia.
Right.
Brandon is on as an attendee. He can't say anything. He wasn't able to be on as a panelist.
I know. I was trying to find the place where I needed. I just added him on. I was trying to find my view all attendees. It had hidden. It was hidden from me.
Thank you.
Thank
Chair.
you.
Thank you so much. So I wanted just to speak on the Hermosa at 21st. So that is the normal. Just to clarify, that is the Meharry's testing area. That is the reason that I believe they're highlighting Hermosa is because Hermosa is the way that you come in. So you want to go to Hermosa and 21st.
Oh, okay.
If you would like to be tested there, that is the route that you must take. So you'll come Hermosa on the south side of Meharry.
Right.
You'll then head north, and then you'll do the drive-through testing there. I've actually used that drive-through testing.
Okay.
Yeah.
Okay, well, that's good to know.
It's
I know
quick and efficient.
Councilwoman Suarez had indicated also that it was the site that they had put up a couple of weeks ago. So are there any other comments, questions as it relates to COVID-19?
Madam Chair, this is Councilwoman Vercher. There was mention of Nashville General Hospital and the utilization of it as it relates to this pandemic, but we don't have all of those details. I want us to be overly sensitive as it relates to the utilization of the hospital, primarily because for our agencies that serve our communities, it's really hard for us to overcome a stigma once it is latched on to us. We've had an incident, not with General Hospital, so let me be clear, because I know this is being recorded, but in the history of Nashville, when we had the TB outbreak, many may not remember, but Madam Chair, I'm sure you do. You're old enough to remember. A particular hospital had that stigma, and it ended up being closed. Right. So we just want to make sure that we are sensitive in how our agencies are being utilized and branded as we all work towards assisting those in our communities. We have to be cognizant that we can't use a cookie cutter approach as it relates, because the reality of it is not all agencies are created the same. And that's just the reality that we have here in the city. In this caucus, we've talked a lot about equity. We just need to make sure that that's always in the forefront of our conversations, along with our branding for these agencies that a lot of us have given blood, sweat, and tears to make sure that they are still open, specifically General Hospital. Also, Madam Chair, if you can, with your communication with Metro Action Commission, if I heard the councilwoman correct as it relates to the Social Security numbers, if we can frame that into an ask, because we don't necessarily know. I do know with Metro Action Commission, certain PIIs are required because of their federal and state reporting that they have to do. And if that is the case, we want to make sure that they're using the proper framework so that we aren't creating additional barriers for those that already have challenges and getting the services that they actually need.
Right, I agree. Thank you. Councilmember Suarez, did you want to say something?
Yes, Madam Chair, and I don't know if this was discussed before I got on, but speaking to the equity, and one of the reasons why we choose to have this meeting, I know it's in knowing the numbers of African American impacted. Do we have an update as to if that data is forthcoming, and do we have access to it, and all of that? I think whatever decision we're making will be based on that or is tied to that. And I just didn't know if that was updated in the call before I joined in. If it is, my apologies for missing that. But I wanted to know if we have data forthcoming on that this time.
Well, to my understanding, Tennessee was not collecting data regarding race. You know, as we spoke earlier, um, Dr. Hildreth had indicated that African Americans, no race was more susceptible or least susceptible than any race. So as it became more of an issue and people were asking questions and other cities were providing information regarding the African American community, I think it did become, I actually met with the mayor last Tuesday and he was asking me about that. And I told him that I thought that they needed to answer the question, that they needed to be able to provide that kind of information. And if they were, they should start collecting that data in order to get it out there. Because when they don't provide it, then of course it feels as if they are hiding again, and we don't want to feel like there's hidden racism or there's something that they don't want to share with the general public. But as far as I know right now, those numbers have not been presented. And I know I read in the Tennessee Tribune today that there were like Reverend Percy Clark from Mount Calvary and Clarence Kilcrease and David Driscoll all passed from complications of coronavirus. And I'm not sure if they, because I do know that Clarence Kilcrease had been very ill for quite some time. And I know that the virus may prey upon those who have those underlying issues. But I'm not sure if they are claimed of their fact or not. And I'm not sure how one would actually know, because if he was isolated because of his illness or who brought it in, how could they get back down to the root of it? It's such a complicated situation. I'm just not sure. So the only thing I could do is keep asking the questions and asking if they will provide that information. But right now, I don't think there is any available for them to share. Although they do know that when majority of people get colds, African American community gets pneumonia. And it was something that you had, Councilwoman Virtue, I forgot it, you had mentioned. But Nashville General, that's what it was. In terms of working with COVID-19, of course, you know, Vanderbilt has also been a lead agency and a lead hospital in dealing with the pandemic. And I understand that Vanderbilt reached out to Nashville General, I think it was Friday, to indicate that they wanted to work together and wanted to be able to work, I guess, congruently to make sure that they do everything that they can. Nashville General does have rooms available, beds available, and they have staff to be able to do it. And personally, I'm happy to see them because there are some people in the community who love and trust Nashville General, person like myself, and would love to see them reach out to the community and let them know that they are here for the community, and whatever their needs are, they will be most certainly addressing them. I know that I had a hand from Councilwoman Lee, Councilwoman Toombs, and Councilwoman Gamble. If you all could speak in that order, I'd appreciate it. Councilwoman Lee.
Yes, ma'am. Can you all hear me?
Yes.
Yay. Okay, so please forgive me. I had problems getting on. If you have answered this, please bear with me and answer it again or speak to it again. I had a constituent who was very concerned about, when we're talking about COVID-19, about people coming out of the prison systems. We know that before anybody goes into the prison system, they are tested and they are, security goes through with the sanitizer and the spraying them down and all that kind of stuff, because it is thought that somebody, if it comes into the prison system, somebody has to bring it in because they were already in here. So she wanted to be very concerned about the people who were entering back into the communities needed to be tested just as well as the folks that are coming into the prisons.
Right. Well, I know that all of them are particularly following the process. Once someone has shown symptoms of it, they are getting those individuals isolated and away from the general public, making sure that they get tested, we're getting the results and putting them into care once they find out that they may actually be positive. And I know that that's basically has been the process for all the entities when it comes to COVID-19, because they know that that's what has to be done in order to flatten the curve of new cases.
Right.
So
I think her major concern, and I'm just putting it out there because I said I would as the conversations happen, I think her major concern has to do with people who are in the prison system, did not have it, but are now coming out, because it can stay in your system dormant for at least 2 weeks. So if somebody had just brought it in, they got it, no symptoms yet, that she just wanted to make sure that people, or the conversation around people, even though they shouldn't have it, because you don't know, that if they are being released, that they go through testing the same as people who are brought in.
Okay, so I don't know. I think that's probably a question that we would have to give to the mayor and allow them to respond. And it very well may be on the level of state government and them addressing this as an issue, because the Department of Correction for the state of Tennessee, I'm sure would have to put down a mandate. But I will definitely, I'll make a note of it and reach out to and send something to Dr. Janhari.
Thank you, Madam Chair.
Okay. And Councilwoman Toombs?
Thank you, Madam Chair. I just wanted to make a point about the race-based data. Dr. Jahanger said that information is available in regard to confirmed cases. It's just that they hadn't, I guess, there wasn't a focus on it, so they didn't have a way to pull it in a way that they could present to the public. But that information does exist, so I think that we should definitely keep pressure on them to put it together in a report that they can present to us and the public.
Right. You're right. That's a good point. Thank you. Councilwoman Gamble?
Thank you, Madam Chair. I just wanted to, I guess, also piggyback or comment on the race issue, or the fact that African Americans are not more susceptible, or no race, and the disease does not discriminate as far as race. However, African Americans are at more risk, it seems, because according to research and the New York Times articles and other articles, because of the work that we do, many working in frontline jobs such as bus drivers and grocery workers, and not having access to tests and healthcare. So my question is, I'll be meeting with the regional manager at the Walmart in my district tomorrow to see and learn about some of the protocols that Walmart is doing to keep customers and employees safe. And I'm wondering if there's any interest amongst the caucus to start communicating or messaging about the importance of protecting our frontline workers, like MTA drivers. They're needing masks, they're needing gloves. Same thing with the grocery store workers. If there's interest in us spearheading an effort to make sure that frontline workers, just like people are making sure that our nurses and healthcare workers get the PPE equipment that they need and the testing that they need, if we might do that for the service industry.
Right.
Hi, Jennifer. This is Joy. I actually just spoke this morning to ask if it was possible to actually require that and to do a late file for next week's meeting. And I'm waiting to hear back about that because I had an experience this weekend of going into a store and half of the store employees had absolutely nothing on. And the store said that they were giving them the option of wearing protection over their noses and mouths. So I can certainly, as soon as they give it to me, share it with everyone. Take a look at it.
So Councilwoman Gamble, would you be willing to spearhead that to let us know what it is that you'd like for us to do to help?
Yeah.
Because I think it's a great idea.
Yes, I would. Yes, I would. I would definitely be happy to do that. And after I meet tomorrow with the manager, then I'll be able to put together some bullets or some things that we can start talking about, some talking points and things that we can do. I appreciate that. I'll do that.
Okay, well, great. And if you get it to Rosie to make sure that it comes to the council member.
Okay,
we'll do. Okay, thank you. So are there any other comments that anyone wants to give? Councilwoman Virtual?
Thank you, Madam Chair. Councilwoman Gamble, excellent idea. Madam Chair, in your meetings with the mayor, has he alluded to changing his overall directives for the city? I think that'd be an excellent charge for the caucus. But I don't want us to be having a different message from what the mayor, the public health officials are saying also.
In terms of what specifically?
The mandate for masks and for workers. I think if we had an overall, and I've stopped following it because the updates every day is just too much for me. But if there was a citywide mandate to require it, I think right now there's so much, the language is too loose. So it's subject to households, their own interpretation of what we're saying as a city. And I understand it. I get it. It's sensitive. They're trying to alleviate chaos and all of that. But I think we're at a point, to Councilwoman Stiles, what she was stating with her issue in the store. I think we need just stronger language in the city. And to Councilwoman Gamble's point, if we could be stronger and encouraging the mayor to issue a citywide mandate, that would get us a lot. That would get us a lot further than sponsoring. And I'm not saying that it's not needed. Sponsoring legislation with no enforcement behind it at this juncture. Right. It would be more ceremonial. The teeth in it would be from a mayoral mandate citywide with fines attached to it, and the mayor can do that. We can't do that as a caucus.
Okay. Well, what I would do as a yes.
Sorry, to Councilwoman Verser's point, I actually spoke this morning with the mayor's office in regards to that and seeing if it could be added to the safer at home order, and was told that they're going to look at that and would have a response in about 48 hours.
Perfect, yeah.
If it could be added to the safer at home order. So I can let everyone know when I hear back.
But what we would do is, as a result of the caucus meeting, I will just send a couple of questions as it relates to the African American race and that data, making sure that they provide that. And then also mention about the prisons as Councilwoman Toombs, and then also speak on the fact of doing a mandate to require masks. And all of that will be, because I think we have to hit them from every approach, that the Minority Caucus talk about it, individual council members talking about it, and that I don't think they can get too much of it. So I'll make sure that I follow up with some kind of written document based on what we've had here today.
I'm okay with that, whatever language you come up with.
Madam Chair.
Just add my name.
Yes. Yes, I will send it on behalf of the caucus. I appreciate that, yes. Was that Councilwoman Swara?
Yes, I had my hand raised, so I was waiting.
So I'm not seeing them all at the same time, so I didn't.
Yes, ma'am. Yes, ma'am. I like the conversation. I like where it's going, and I like what you said about we have to look at it from so many different angles. And I think the solution that we need to propose does not have to be one or the other. It's a combination of so many things. So as you're talking to the mayor, I think also talking to the businesses and large employers, and making sure, like Jennifer said, and making sure that that's been done. I think we can move those two from. The other area that I also think as a caucus, I would like us to be able to, if possible, if we agree to also issue a statement of some sort is on healthcare generally with the state expanding Medicare. Because I know that at the end of the day, part of the issue that we're facing is that a lot of people do not have medical coverage. And so even if you get diagnosed, how will people pay for it? There's a whole lot that is tied to that. And so when we're looking at this issue...
Can you slow down a little bit? Slow down, please.
So basically what I'm saying is that we need to look at not just the symptoms, but we need to look at what is the root cause. And as long as we're addressing disparity as it relates to health care for the African American community, and we're looking at all the things we need to do, I think it's not outside of our jurisdiction for us to be able to talk about the state expanding Medicare for everyone. And so that's just, I wanted to be part of the approach of not just stretching one side of it, but looking at, since we're looking at the whole thing, to
Right.
that if that is possible to part of the conversation.
Right. Absolutely. Councilwoman Percher?
I want to clarify, I'm not saying it's a either or. I'm just saying if we can just work in tandem. Also, Madam Chair, if you can request from our state senators the updated available resources for COVID. Senator Gilmore and Senator Yarbrough they have a town hall, virtual town hall while we're having our caucus meeting. But if they can send those resources to you, we can get those out to our respective communities too, with the understanding that this information is changing daily.
Right. Okay, I can reach out to Senator Gilmore and ask her. Councilwoman Porterfield.
Thank you so much, Madam Chair. To Councilman Barcher's point about getting those resources from the senators, the virtual town hall is tomorrow at 5. So we may be able to tune in if we don't have other meetings scheduled at that point in time. But I do think that that's an excellent idea to make sure that we are sharing those resources. A few people reached out to me over the weekend, so I've been working on getting some questions over to the mayor's office, similar to what some of the other council members have mentioned about the requirement of gloves and masks when employees are essential workers are out. One concern was about our MTA bus drivers. There was a bus driver in another state who passed away from COVID after doing a video with concerns of someone getting on the bus and coughing and spreading germs or possibly spreading the virus, and he passed away. So I did reach out to WeGo with questions and concerns about what we as a city are doing to protect our drivers. And they did send some information out to me, and they've now sent information out to the whole council as well, with regards to ensuring that they are providing equipment, they are providing gloves and masks. They are giving bus drivers the opportunity or giving them the guidance to allow people to enter in on the back of the bus so that there's not a group of people around the fare box, and they are giving them the option to waive the fare if there's a group of people congregating around that fare box. Another concern that I received was about construction workers not having protective equipment. So finding out if we as a city could make that a requirement that employees are providing masks or making masks mandatory for their employees. And then the last concern was with regards to the verbiage around the temporary shelter at the fairgrounds, as well as the testing site for Nissan Stadium. Currently, the Nissan Stadium is being advertised as a facility where you can drive up. You have to call and get screened first, and the person who sent the email is a volunteer at that particular site, and said that the site actually has walk-up services as well, and they also do screenings there, so you don't have to call in first. And they felt that by advertising it in a way that you have to call and that you have to have a car to drive through, that could be a barrier for people who may not have transportation, for people who may not have access to a phone or a cell phone. So, they felt that was a barrier, and that it was not marketed in a way that it was equitable to all people. So the concern was making sure that the city is letting people know that, you can walk up and use that service. So that's something I was in the process of drafting an email to go to the mayor's office with concerns about that. The other part with regards to the temporary housing shelter at the fairgrounds, the same person was volunteering at the shelter and said that the unhoused individuals that are there have not been given masks to wear at the shelter, despite the CDC making a recommendation for people in public spaces to wear masks. So they are personally trying to make and create masks. But they did have concerns to make sure that the unhoused individuals that are there are at least getting masks getting masks while they're there, so that they could hopefully be as safe as possible. So those are some emails that I'm working on to the mayor's office. Councilwoman Hurd, if we want to look at those things as a caucus and include that, I'm supportive of it, or I can send the emails out individually, whatever the will of the body is. I'm okay with it.
Well, I think it probably would be good to be consistent in whatever we send out. If kind of like those form letters that we get all the time, just to make sure that that the emphasis are there. But I do think that we need to send something as a caucus first and foremost. And then I also believe that each council member who has concerns, and just as you've been eloquently stating, those issues that have been brought to you, I think, again, having a number of approaches and making sure that all of this is emphasized so we can get the response that we need is very much in order. Councilwoman Suara, your hand has been raised for a while. Is this the same, or was it from the first time that you had raised your hand?
No, ma'am. What I wanted to, I think the CM Patafik may have said it, but what I wanted to add in is that it seems as if everybody is doing so much, but I think it would be better, like you rightly said, if we can pull it together and put all those issues and address it as a caucus. That would be my recommendation, instead of everybody going to the mayor's office individually. And I said that because I did that too with regard to the unhoused. I had a question about that, and I actually suggested doing a tour of the place based on some of the emails that I received, and so we're working on that. But it occurred to me that we're all doing the same thing. We're all receiving information. We're all trying to do the best that we can. But if we can use the caucus as a stronger arm with all of us signing together or signing as a body, I think it will be better for us. It would also be better for the mayor's office because they're not having to deal with 5 or 6 individual people. So I want to suggest that if everybody can send those issues to Madam Chair that they've come across and the things that they've done, and then compile that, I think it will be more powerful. I will forward what I have or what I've received or done with the unasked population, with the administration. I'll send that. But I think that's what I'm hearing. We're all busy working. But I think it's always better when we do it together.
Okay, thank you so much, Councilwoman Suara. Councilwoman Sepulveda.
Yeah, just one more thing. So I've started to write my newsletters in Spanish as well to provide translated updates when it comes to COVID. If you guys ever need help with translating something in Spanish, or if you need help communicating with some of your constituents and they speak Spanish, I'm always available to do that for you guys on the phone or over email, whatever works best for y'all. I know that Fabian at the mayor's office is doing the daily briefing in Spanish, and hopefully we could expand that to other languages. But in the meantime, if you guys need help, I'm always available.
Okay. Thank you very much. I'm sure that those who have larger Hispanic and Latino constituents would really love that. No, it's very, very helpful. So, are there any other comments as it relates to COVID-19? There not being any. I want to just give you an update and let you know that in my meeting with the mayor last Tuesday, I talked to him about Nashville General Hospital. And basically what I asked him to do is to consider 3 things, and that was to help promote Nashville General as a Tier 1 hospital with Blue Cross and Cigna. If they are listed as a Tier 1 hospital on all of the listings with Blue Cross and Cigna as an option, that serves as an influencer for people, especially Metro employees, because I do think that they could utilize Nashville General for some of the basic things like the x-rays and the mammograms and, things that we need, and they don't necessarily need a Tier 4 or trauma center in order to have those things. And that will actually raise the monies that Nashville General gets, which means that will reduce the money that we give to Nashville General in order for them to sustain those services that they provide every day. The second thing is that I had asked him if he would consider doing those screenings at the public housing facilities on an annual or semi-annual basis, because I know the last time that was done, there was about 70% of those people who had some underlying issues that had not been realized. And then there was about 5% of them who actually had diabetes, and just a number of issues that they were able to address at that time and help get those individuals into some care. And the best solution is always prevention, and offering these kinds of screenings always are very, very helpful. And he was very, very helpful with doing that. And also asking him to increase the utilization of Metro employees. You know, the one thing that I loved about Nashville General was them opening up the location on Charlotte Avenue. Since then, that's been less than a year, and it's been over 1,000 new patients that have gone to that location, and it's been, I think, 163 Metro employees. With it being so easily accessible, they can get down there, get the services that they need, and get back to work during a lunch hour. And I'm really happy that the mayor found all three of those recommendations to be feasible and doable. In fact, Mike Jameson had indicated that he was going to reach out to HR, to Shannon, and ask her to start to promote that and try to incentivize the employees to utilize that, because when they do, it basically saves them like 40 cents on a dollar, every dollar right away, immediately, because they don't have to pay the other high costs for private hospitals that they are admitted to, or where they go for those same general services. So it was really a good meeting. I think everyone will win from it. And as a matter of fact, I talked to him about the COVID-19, and the mayor went and spoke to the state, and he spoke to Vanderbilt, and as a result, Nashville General is going to be one of the hospitals to address the COVID patients that come in. So it's not going to be that this just targeting Nashville General, but they're going to be in partnership with Vanderbilt to make sure that we serve the entire community at large. And those were just some of the things that I thought we wanted to share, since Nashville General was one of our agenda items when we started out with the caucus, that we were going to stay on top of. Councilwoman Vercher.
Thank you, Madam Chair. Do we have the details of that collaboration?
No, I don't have it in writing. I got my information through Dr. Webb.
Okay. Can you add this to your tickler if we can have if we can get the details of that collaboration, just to make sure that the service isn't disproportionate as it relates to the collaboration.
Okay, I will.
And I'll just speak candid. Just want to make sure that whatever the collaboration is, it doesn't present a situation where the burden is solely on General Hospital.
I get that, but Dr. Webb was concerned about that too initially. But after his conversation with Vanderbilt, he felt really good about it. He was very pleased and happy with the results of the conversation.
I'm glad he is. It's just the current and again, I'll just speak candid. We know Vanderbilt pushes uninsured over to General Hospital. So again, my concern is just making sure that it's not a disproportionate collaboration, because in the event it is, it'll be more of a burden to General Hospital.
Right. I get that. I most certainly will. Any other questions or comments? Not being any, we'll have a report from our treasurer.
Thank you, Madam Chair. So just a couple of updates. I have set up online banking. We didn't have it set up before, not that I'm aware of. And so we have had that set up. I have started a QuickBooks. And you guys don't have a full detailed report in front of you guys today because I barely got set up with the login with our bank today, and so I haven't had the chance to reconcile our QuickBooks and our bank account. So as soon as that's done, you guys should have that. It should probably be a little bit later this week. And let's see what else. So our balance right now is 5,641.74 cents. Now, I don't know how detailed you want me to go into this, Madam Chair, since we are being recorded. Just
I think that's fine.
Okay.
What you provided.
Okay. So I do have a question. So from our Minority Caucus reception, there is still some outstanding invoices and one check that did bounce back. And I know that the Maynard group was following up with those outstanding checks. Should someone reach out to them? I don't know if it needs to be me or if it needs to be you, just to follow up on that income that still hasn't come in.
Absolutely, I can do that now. As a matter of fact,
Great.
And if you'd like to text me the name of the group, so I'll be aware of what to expect, I can make sure that I reach out and follow up.
Yes, ma'am. I'll do that. And we also haven't collected dues for one reason or another. Sometimes I have been able to attend the meetings, and then we had tornado, and then we had COVID. So we haven't had a chance to go into detail about paying dues. And so I haven't had dues from anyone in the Minority Caucus yet.
Right.
So I know there are 100, correct?
Yes.
And just by looking at some of the records from previous years, it looks like you all extended an invitation for other council members to also join in contributing dues. Am I correct?
No, actually, it was really the Minority Caucus and some of the other, well, I can just speak on the last 3 or 4 years. And Councilwoman Virtue, you can answer this more succinctly and more accurately than I. However, I think that the other council members saw that, if they had a large number of African American or minority constituents, that they wanted to be a member of the Minority Caucus and they attended meetings, or if they were a part of the LGBTQ community, they thought that would, qualify as minority, and they attended. And that's why it probably appears that it was opened up for other council members, so to speak. But after a while, and some of them just decided that they were not going to continue as a member of the caucus. Councilwoman Virtue, you want to respond any?
Can you hear me?
We can now. Hello? Looks like we may have lost Councilwoman Virtue. I'm still showing you up.
Can you hear me?
Yeah. You going in and out. Sandra, are you still with us?
I'm still here.
Okay, because you're showing up fine. I don't know what's going on. Councilwoman Gamble, you want to go ahead and speak? I see your hand is raised until we can get Councilwoman Vercher.
Thank you. I just had a question for Council Member Sepulveda, and you may have been getting ready to say this before we got interrupted, but is the only way to pay the dues through check? I mean, is there a way to pay online or any other
Madam
way
Chair, can you hear
to
me?
pay our dues?
We can now.
So as of right now, we do not have a way to pay online. We're trying to figure out a couple of things because we also don't have the capacity to transfer money over and receive wire transfers through our online banking. So as of right now, the only way to pay dues is via check. And, I'm sorry?
Sandra.
What cash?
If I may,
Yes.
Madam Chair, I would work with Council Member Sepulveda, and we can do credit card and QuickBooks. We can also set up vendor payments and QuickBooks. So let me work with Sandra on that, and that is something that we can have the capacity to do. We may want to, if people want to start, but I want to work. Sandra wants to get out that. I'll work with you to see if we can set that up, and that will make it easier on everybody if we can get that going.
That's awesome. Thank you, Councilwoman.
That would be great. Thank you.
I'm not sure what's going on with Councilwoman Vercher. But I just wanted to reiterate the $100 dues for each council member, just to help make sure we have funds to do some of the things that we've been able to do. And I will follow up with the Maynard Group to see if we can get those accounts receivables in. I'm just waiting for Councilwoman Vercher. Other than that, we are basically done with our agenda. Did anyone else have any new business that they wanted to discuss?
Madam Chair, not a new business, but I just want to put it out there. One of the things that I'm doing because of my professional background is trying to work with people on the financial side of the COVID, which is resources for businesses and finding unemployment and all of that. I'm not charging money. I'm doing it with organization, but I would want to send all of that to the caucus members once I have the next update. We're doing some webinars and doing some video stuff. We're also trying to look into how to videos in English and in several languages to share with people, because a lot of people that are impacted, some of them are self-employed, some of them have their own businesses, don't know where to go. And so I want to put that out there. And then once that, I want to share past resources, and then as we put up some new ones, I want to go ahead and share that. And if any of you have anyone that have any question, I'll be more than happy to answer it as a CPA and somebody that's working for a number of years. I want to put that out there as well.
Okay, thank you. Thank you very much. Councilwoman Toombs.
Thank you, Madam Chair. This is not new business, but I just wanted to, something just popped in my mind about the charitable giving for COVID-19. I know with the tornado money that was distributed through the community foundation that we've been like keeping our eye on those funds.
Right.
The city partnered with United Way for COVID-19 financial assistance. Are we also watching that money to make sure that it's going to organizations that are particularly focused on minority communities?
Well, you know, we should. Let me put it like that. I know I was with another group we were talking about trying to collectively join together and help with the tornado relief. And I suggested that to that group, but they wanted to just stay focused on tornado. relief.
Okay.
So if that's something that you want to do, I think it's
Okay.
very important that we, follow up on that. Because I saw that initial, whoever has the dogs, mute their phones. Okay, thank you. I think it's very important for us to follow up with that, because I did see that first round of funds that were distributed, and there were no organization in the minority community. So I agree, Councilwoman Toombs, and I would love for you to follow up with that.
Sure, I can definitely do that.
Absolutely wonderful. Councilwoman Porterfield.
Thank you so much, Madam Chair. I just wanted to share some information that I received. I think will be very helpful. I'll be sharing it out on social media, and I asked in my newsletter, and I asked that if you all would to please share that as well. The mayor's office is hosting a virtual job fair all week on the Nashville, on the NWN website. Is the Nashville Workforce Network.org. I'm sorry, I may have misspoken. I don't think this is with the mayor's office. My apologies. But this is a week-long virtual job fair event, and it is over 100 employers and community-based organizations that are hiring currently. So they're focused on helping people that are maybe self-employed or people that are out of work due to the coronavirus. So again, I'll be sharing that out, and I would appreciate if anyone else can help share the word to anyone who may be currently looking for employment during this time.
Okay, thank you. Councilwoman Suara. Okay. Councilwoman Virtue, are you with us? Seems like we've lost her. Anybody else have a comment they want to make? If not, then I will entertain a motion to adjourn.
So moved. Second.
Good. Thank you all so much.
Thank you, Madam Chair.
Bye-bye.
Have a
Take
great
care.
meeting.
Thank you. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.